Topic 5. Supportive communication practices in the counselling context. People with intellectual disability will have specific communication needs. In this topic, we will consider common communication needs and supportive communication practices for supporting recovery from trauma in the counselling context and beyond. Difficulty with abstract thought and complex language. Many people with intellectual disability have a very literal interpretation of verbal communication and can have difficulty understanding abstract concepts. Examples of abstract thinking that commonly cause difficulty include mathematical concepts such as time and money, metaphors, euphemisms and analogies, humour and jokes, emotions and feelings in themselves and in others. Understanding emotions can be challenging for people with intellectual disability. The language used to describe emotions is abstract, yet the reality of the emotions they experience can be very concrete. People with intellectual disability often experience intense physical or behavioural responses to unexpressed emotional states. This is due to their limited means of identifying and expressing feelings. This difficulty of expression is often compounded by a high level of experienced trauma through abuse and exploitation. Strategies. Connect the abstract label of the emotion, for example when feeling sad, to the corresponding physical experience in the body. I cry, or I'm flat. This can help people talk about their emotional experiences and assist them to find ways to recognize and respond to emotions. For example, a person may not be able to talk about their nervousness, but can talk about feeling sick in the stomach. Ask questions like, "Where do you feel that?" Or "Can you show me how that feels for you?" What does your face or body do? To help the person identify what they are feeling. Approach this work with a sense of patience, commitment, and curiosity. It can take a long time to uncover the different understanding and experiences of emotions for each client. Masking and acquiescence. People with intellectual disability often mask their difficulty with verbal communication to avoid the stigma associated with having a disability. Masking can take the form of using rote, learned statements when responding to questions, when in conversation, or to navigate everyday experiences. For example, "I don't know whether I'm Arthur or Martha." Learned behaviours, to get care or help, to fit in, or to get someone to go away. For example, smiling inappropriately or appearing helpless. It is very common for people with intellectual disability to take on a passive communication style, where they let the more powerful person in the conversation take the lead. In this way, acquiescence or compliance is a way of masking disability. Possible reasons for acquiescence include: the person may not understand what was said, so they agree with it in an attempt to cover or mask their misunderstanding. They find it difficult to say no, particularly to someone perceived to be an authority. They don't want to say no or fear saying no and agree with what is said to avoid getting into trouble. Strategies. Ask clients for advice on how best to communicate with them. This can give counsellors valuable information while empowering the clients through communication of their needs. This is likely to reduce compliance. One of the wild counsellors says, "You have to make me work because I'm the one getting paid." Be alert to inconsistencies between what a client is saying and their body language. This might indicate a real difference between what the person is saying and what they would say if they felt able or empowered to do so. Work slowly and with repetition. Check for understanding along the way to make sure the client understands the discussion and communicates their genuine wishes, opinions, or decisions. Do not over or underestimate what the client understands. Do not pretend to understand what the person is saying when you are not sure. Continual checking on the understanding of both the client and the counsellor is important. It is better to gently check than to continue under false pretenses. Give the client permission to say if they don't understand and encourage them to do so. For example, a counsellor might say, "I want you to tell me if I'm not clear or I don't make sense to you, so I can do a better job." Attention and memory. Many people with intellectual disability experience a short attention span, have gaps in their memory, and have difficulties with memory processing. The degree to which this has an impact on communication in the counselling context depends on each individual and how well the counsellor can assess the individual's communication ability and adapt their practice accordingly. Sometimes a client might need to talk about a particular topic or experience that initially seems unrelated to the counselling session. It is both helpful and respectful to allow the person some time to talk about their topic before focusing on the counsellor's plan for the session. Seemingly insignificant topics might turn out to be important. Anxiety before and within the counselling session is common. Many people will understand counselling as talk-based and fear failing to communicate well. It is important to understand the way anxiety and stress impacts on an individual's memory, attention, and concentration. Counselling may trigger a trauma response, and clients may demonstrate avoidance strategies, such as resistance. Strategies. Use more frequent, shorter sessions. Be prepared to work slowly and with repetition. Adjust the speed of your speech to help the client comprehend and retain information. Use imagery and create a visual record of counselling sessions as a useful way of recording the sessions and as a way to review, enhance memory, and observe change over time. Normalise the use of drawing and artwork in counselling with adults. Creating drawings to record sessions may seem childlike or embarrassing to some clients. Explore the use of imagery sensitively with each client to avoid insult and/or embarrassment. For example, the counsellor might say, "I really like to use drawings to help me understand some things. Do you mind if we do a drawing of what we're talking about?" Externalizing, through the use of symbols, can be a helpful way to give a client another view of their lives. This can provide a less intrusive way to discuss alternate behaviours. Sequencing. People with intellectual disability can have difficulties sequencing events and understanding the relationship between choices, actions, and consequences. This can be particularly challenging when there are multiple subjects and events in the story. When people tell their story, it may seem out of order or illogical. However, it is important to let the client tell their story in their own way, in their own time, in full, and without interruption. Counsellors may need to rethink their assumptions about the client's aims in telling their story. Telling a chronological, well-structured story may not be a high priority for the client. However, people will use their own language and methods of communication, and this may differ greatly between individuals. For example, some people may have great difficulty telling a story in chronological order, while others may feel great discomfort when telling their story out of sequence or being interrupted. Strategies. Counsellors have a responsibility to adapt their communication so that they can support the client to understand. Don't use jargon, and remember commonly used words like goals and consequences are abstract concepts and might not mean anything to clients with intellectual disability. Do not expect the client to conform to a standard way of storytelling. Listen patiently as the person tells their story. Sometimes this will be over a number of sessions. Attempt to make sense of what the client has told you as a whole. At Wild, a counsellor may draw evolving maps that include the story over time, the different relationships involved, and what the client was feeling at different stages of their story. Questioning. How a counsellor asks questions may lead to complexities and different outcomes when working with people with intellectual disability. The careful use of questions may ease a client's confusion and embarrassment, clarify their problems, goals and intentions, and provide them with an increased opportunity to be heard. Counselling practitioners must develop a high level of self-awareness in how they ask questions when working with clients with intellectual disability. Strategies. Use concrete questioning. Ask the who, where, when, and what questions. Avoid the why. Keep questions simple. Pose no more than 2 options in one sentence when asking a person about what they want. For example, would you like to stay at home or go out tomorrow? Rather than, would you like to stay home or go out tomorrow or just go out for a little while? Avoid double-barreled questions. This refers to asking 2 questions about different subjects in one sentence. For example, don't ask, how do you feel about going out today and going in the taxi? Instead, ask, how do you feel about going out today? And then ask about the taxi separately. Avoid the use of negative and double negative questions. These can be difficult to interpret and answer because a yes response to a negative question denies the proposition of the question rather than affirming it. An example of a negative question is, didn't you see Mum last night? If the person answers yes, it means they did not see their mum. Instead, ask, did you see your mum last night? An example of a double negative question is, didn't your mum tell you not to come over? This type of question is confusing and makes it difficult for the person to know how to respond. Instead, ask, what did your mum tell you to do? Or what did your mum say to you? Communicate in short sentences. Break questions down to one main idea. Use plain, simple English. Signpost the conversation. If the conversation gets confusing for you or the client, stop and say you are starting over. For example, can we stop talking now? I would like to check that I got what you are saying to me. Use a combination of open and closed questions. Begin with the open question, then ask closed questions to confirm details or clarify meaning. For example, would you like to tell me about your family? This is an open question. And do you have an uncle? Which is a closed question. If you ask a question that is unclear or confusing, apologize and try again. Behavioural issues in communication. People with intellectual disability are often referred to counselling because of a behaviour change that is causing problems for themselves or others in the home, workplace, school or wider community. Challenging behaviour is a common term in the intellectual disability field and is used to describe any behaviour that negatively affects a person in their daily life or negatively affects the people around them. The kinds of challenging behaviour that people with intellectual disability might display would include aggression, self-harm, property destruction, defiant, hostile and non-compliant behaviour towards caregivers and authorities, socially inappropriate behaviour, including sexualised behaviours, and withdrawal. Challenging behaviour should be viewed as a form of communication. There are many reasons why a person with intellectual disability might display challenging behaviour. These can include physical pain or discomfort that is recognised or unrecognised, medical conditions, medication, epilepsy, substance abuse, mental illness, trauma, abuse and exploitation, communication difficulties, lack of self-determination and control over life, social isolation, grief, loss and bereavement, life stages and transitions, frustration, unhappiness or fear in their living and working environments. It is important that people with intellectual disability who display challenging behaviour are not labelled as challenging themselves. It is important not to dismiss a person's challenging behaviour as an inevitable feature of their disability. Clients with intellectual disability who experience difficulty with their behaviour should be taken seriously and given support to explore the causes of the behaviour and to develop strategies to manage it. Be curious about what the behaviour means to them. Remember, the problem is the problem. The person is not the problem. Behavioural issues may also have negative impacts on the client and the counsellor within the therapeutic context. Difficult behaviour in counselling may be related to a change the client is looking for in the counsellor, or a change in any other context that is currently affecting them. It is important not to assume that because a client has arrived for their session that they want to be there or that they are ready to attend in a calm manner. Useful strategies for supporting a person who is displaying challenging behaviour in counselling. Maintain your self-awareness and critical reflection to ensure that a client's negative reactions to counselling are not taken personally. It is probably not about you. Remember, the client is trying to create a change, and they can't see any other way to achieve this. Work hard to understand the messages behind the behaviour. Foster an environment of learning and understanding with the client, rather than punishment for what is a communication problem. At Wild, counsellors might ask, "What do you want, right now?" Create safety in the therapeutic relationship. Focus on trust, and take the time needed to build genuine rapport. Demonstrate commitment to helping the client by showing that you will not judge them or refuse service due to their behaviour. Use symbols or artwork to help the client find other ways of expressing their needs, wants and desires. Try a less formal approach. Use humour. Create a new and less threatening conversation. For example, at Wild, a counsellor might ask, "What would help?" One client requests playing games on an iPad. Quiet conversation can be resumed as they play. Do not punish a client for their behaviour. Openly explore concepts of other people's feelings and apology through concrete examples that are meaningful for the client. For example, how would you feel if that happened to your friend or mum? Refer to someone the client respects. What would your mum or friend feel about you doing this? Refer to a significant, non-judgmental person in the client's life. Confabulation or exotic storytelling. Confabulation or exotic storytelling is a common technique used by people with intellectual disability to gain respect and the approval of others. The stories they tell are often a reflection of the way a person wants to be seen, and are a means to try to increase other people's positive opinions of them. It is often the lack of really valuable stories that a person can tell about their lives and experience that leads them to confabulate. Strategies for navigating exotic tales include: remember that people who confabulate are not deliberately lying. They are trying to impress you. Don't deny, diminish, or contest the client's story. There is little point in refuting what is an absolute truth for the client at that point in time. Don't contest the client's story. This sends the message that what the client has to say is not valued. The story may not in itself be real or valid, but the client's reason for telling it is. Remember that exotic stories could be true. Do not disregard anything a client says, as the story will have a basis in reality. Practice deep listening. Try to hear the meaning behind the story the client is telling. What is the subtext? Why is the telling important right now? If it is important to get to the truth for safety reasons, find a way to ask questions that are consistent with the fantasy. This will help the client to reveal what is really happening. For example, at Wild, a client might arrive excited about a new boyfriend. Her past relationships show this may not be safe. Enthusiasm and curiosity was shown. "That's great! Where did you meet?" The response, "On the train." "And when?" "Today." "Do you know his name?" "No." "So, how do you know he is your boyfriend?" "He wants me." "And how do you know that?" "He looked at me." And that can reinforce for you the need for the client to be loved and wanted. Look for and value the real stories that clients can tell about themselves. Confabulation decreases when there are good, real stories to tell.
Thank you for completing Topic 5, Supportive Communication Practices in the Counselling Context. Topic 6 will look at some useful approaches for counselling clients with intellectual disability. But first, please return to the homepage to complete the learning activity.